Right now, we have about 6.4 billion people on the face of the earth that live in low and middle income countries, for which less than 2% have had any access to vaccine. Where that's occurring, we are seeing major activity with Delta, surpassing any peak we've seen. South Africa right now has just hit the highest peak that any country's hit, period, since the beginning of the pandemic in terms of cases, deaths, and hospitalizations. Tunisia's healthcare system has crashed. We're seeing, even today as we speak on the Olympics, the highest number of cases reported in Tokyo since the pandemic began. We're seeing that throughout the world. So what's happening is this virus is, in a sense, almost rotating around the world in a non-predicted way, meaning which country is going to be the next one to get hit. Iran right now is in its 5th surge it's had, the worst one so far. So from that standpoint, if you look at what's happening throughout much of the world, it is at the very peak of the pandemic activity we've seen to date. If you're in the countries that are vaccinated or have access to a substantial vaccine, we're still seeing a major problem. Right now, we have more people hospitalized in ICUs in Florida, Mississippi, and Louisiana than we had at any time in the pandemic to date. If you look at what's happening in all 50 states in the country right now, we're seeing sizable increases in cases. And in fact, if you look, 30 states right now have had over 100% increase in cases in the last 14 days. This is largely among those 100 million people in the United States that have not gotten vaccinated yet, 100 million people. These are also people who have not been previously infected, so they have no residual protection. That's a lot of human wood for this coronavirus forest fire to burn. And so we're going to see marked activity here. Those who predicted no summertime peak, it would be a fall winter peak, I'm afraid you're unfortunately off. This is a summer peak. Why we didn't see more of a peak activity with B117 in April, we don't know. It was Michigan and Minnesota, but this one is for real. It's hitting all of us. And it's hitting England right now on Saturday. England reported 55,000 new cases. They are even have higher vaccination rates than we do. If we had extrapolated that 55,000 to the United States based on population, that would have been about 225,000 cases a day in the US. They're ahead of us by 6 weeks, maybe 4 weeks. We surely have every reason to believe right now we're going to see what's happened in England, what's happened in the Netherlands, what's happened in other highly vaccinated countries here over the course of the next several months.
And England just opened up.
Freedom Day today is probably the most counterproductive, absolutely inane step that anybody could take. It was on the books. They had it planned already, so they weren't going to back down. As you know, their prime minister's in quarantine right now. You know, their health secretary has been infected. You're watching what it's doing this morning in the Olympics. Here we are watching new people literally almost by the hour become documented as having been infected or in quarantine. So I think, you know, we are in a very difficult state right now with this pandemic. The good news is we do have effective vaccines. The bad news is we don't have them for the world. And even when we do have them, we have a sizable number of people who refuse to get them.
So when we say infected, right, I mean, if you are vaccinated, the chances of you going into the hospital and dying seem to be incredibly low. Is that correct?
Well, let me put one qualifier on. It's incredibly low if you're not an elderly person or possibly certain immune deficiency conditions, okay? If you're someone who is elderly, who might be in long-term care, frail, it still is highly protective, but not as good. So where we've seen the real serious illnesses and the deaths have been in vaccine recipients have been primarily in that same group that we see influenza vaccine failures and deaths. But so on a whole, let me just affirm you're absolutely right. The vaccines have been really remarkable. You know, we're still working more on understanding what the one-dose J&J vaccine does. I think we'll be getting more updates on that in the near term. But at least with the mRNA vaccines, it's been remarkable.
Is there any difference between that is discernible in that regard in terms of Moderna and Pfizer when we talk about those vaccines in terms of infection rate with, and we're really basically talking about the Delta variant, right? Because to the extent that there's any breakthrough infections on the wildfire or the
Wild type, right?
the wild type or the other variant. Those are so small that
it's Delta right now. Delta is the 1,200-pound gorilla in the corner. That's the one.
Is there any difference, or do we have enough data to tell that Moderna is slightly more effective against it, or no, we don't.
No, we don't. But to your point earlier, Sam, you raised a very good point about what do we know about Delta. These variants, again, remember, are just mutated viruses that, until last November, we thought that these variants among the strains of COVID were just like talking about the same car, except one's blue, one's red, one's green, one's yellow. It really didn't make any difference how they ran or how they felt. Well, in November, we realized, wait a minute, there are three buckets here of concern about these variants that are really important. One, are they more infectious, as you pointed out? Number two, do they cause more severe illness? And number three, do they in fact actually have advantages to evade the immune protection from either vaccine or from natural infection? Well, with Delta, we know this is much more infectious. Alpha was the one that was really infectious. Well, this is at least 40 to 60% more infectious than Alpha was. This puts what we call the R naught or the RT, this reproductive number, how many people on average will one person infect. We were concerned at 1.5 and 2, meaning for every person, if you infected 2 people, the cases were doubling every 5 to 7 days. This one may be as high as 8. And this is a very certain. Now, to understand that, there was a paper from China that came out last week that was really a very remarkable piece of work where they followed people very closely after exposure to infected individuals, and actually were taking throat swabs, etc., determining what their status was. They found that they actually started shedding the virus with Delta up to a day earlier than it was with other strains. But more importantly, they found up to 1,000 times the amount of virus in the throats and respiratory tract of people with Delta than the other strains. So this can explain why, somebody basically could be much more infectious and cause that transmission. So that's why today when I say, if you are someone who's not been vaccinated, or you're someone who has just decided I'm done with it, this virus will find you.
Well, how connected that is that to then the unvaccinated, right? The metastasizing of the virus, the creation of new variants. I mean, I know it is connected, but how much of that is just a direct impact of lack of vaccination?
Yeah, well, Emma, that's a really important question. And I guess it's kind of a perspective piece. What I mean by that is I'm looking here at 330 million Americans with 100 million are not yet vaccinated. Surely when you get infected, every time this virus reproduces, it lends itself to new variants. It doesn't reproduce well, and many of the mistakes it makes are actually fatal to the virus or less likely to make it more harmful. But a few of them are just the opposite, which we're concerned about. But when I put the perspective of the high-income countries with vaccine, and I look at our 100 million not vaccinated compared to the 6.4 billion in the low and middle income countries, right now that's where the fight's at. That's where the whole issue of variant development is really at its worst. And so, I surely don't want to see variants develop in the United States or any other country with these vaccines, but I absolutely know the major variant pressure is going to come from low-income countries that God knows when they're going to get vaccine in the future.
That's an important point to keep in mind, and I want to circle back on those efforts, like what it's going to take in terms of the vaccination. But just to get back, the Delta replicates at a much faster rate within the body. Is that mitigated by the vaccination? And if it is mitigated by a vaccination, does it also make it harder for a vaccinated person to pass it on?
Yeah, so let me just clarify one thing, because you raised a very important point. It's not that the virus is replicating faster, it's just more of it. It starts showing up sooner, but again, not necessarily because it's in fact reproducing itself faster. It's like if a human gestation went from 9 months to 4 months, that's not what's happening, okay? You just have somebody who's putting out triplets and quadruplets and whatever, okay? And in this case, The vaccines that we have, particularly the mRNA vaccines, the AstraZeneca vaccine, all appear to do a really good job against the Delta variant if, in fact, you have both doses. If you have one dose, you still get protection against serious illness, hospitalization, and death, but not nearly as good as getting both doses. Again, the question still remains about how well does the single dose J&J vaccine work, and we're still trying to collect that kind of information.
Okay, and so does it make it easier? Does it make it harder to pass on? Like,
Yeah. In fact, if you prevent something from occurring, you can't pass it on. So meaning that if, in fact, I don't get infected, then I'm not infectious. And so that's the big piece. So you're right. This is what can help drop transmission. The more people that are vaccinated, think of it like rods in a reaction. This case, it's a virus reaction. And the more immune people we put into that reaction, the less there's going to be. And so you're right. This is what's helpful getting vaccinated.
But I'm not even talking on necessarily a population level. I'm talking in terms of if I happen to get a breakthrough infection having had 2 shots, does it diminish my versus
yeah, I got you.
Versus somebody who hasn't gotten shot? Am I less likely to pass it on because the nature of my infection is not as strong? Because I'm not going to get hospitalized. I'm not going to go. I'm not going to get. I'm not going to get. I'm not going to die. Statistically speaking.
Yeah.
Does that mean that I also have less of ability to pass it on? Is my R not lower than a non-vaccinated person's R not?
We're going to make an epidemiologist out of you yet.
I'm working on it.
I know. That's good. That's good. No, you're absolutely right. That's exactly the case. Is that when we look at studies that have tried to understand how often does somebody who's fully vaccinated, once they do have a breakthrough infection, remember, a vaccine is 90-95% effective if you give millions and millions of doses and you have lots of infections, you're still going to get some people who have breakthroughs. But in this case, it is actually exactly as you said. It actually does reduce dramatically your ability to transmit it on if you should have a breakthrough infection.
Okay, so that's good because, many of us have young children who can't be vaccinated, and
Absolutely.
The last thing you want to do is give your kid COVID. Folks, there's more of what you've just saw where that came from. That's if you hit the subscribe and like button. Thank you. Really, thank you.